Hi, I'm David from Dairy Development. In the previous sessions, we've looked at that initial assessment. The checks that we do on every single casualty in the room, or in this case the garden, to identify are they responding, are they breathing, what emergency services help do we need. When that's completed and you've got the resource, you then need to do a secondary assessment. It's far more detailed and helps us understand what could be wrong with that casualty. We link this together with history, signs and symptoms. So the history is what they're telling us has potentially happened. So if someone's come at a baseball bat at me and hit me in the face, my head's gone back, it could have come back forward. I could have the facial injuries, but I could also have neck injuries. If I've fallen off a ladder and come down to the ground, I could have head injuries, neck injuries. I could have landed on my hips and damaged them. I could have broken an ankle. I might have tripped over and put my arm out. Pressure on that travels up the arm, damages the collarbone. So my mechanism injury would make me think, okay, I hit the hand, but what's going on with the collarbone? It helps me rule out where their injuries in the body might be. We've then got signs. So looking at, as I approach my patient, is there blood on the floor, which could suggest there's a bleed going on somewhere? Is there a pool of vomit? So the casualty is thrown up and you can see it on the floor. This is different to your symptoms. The symptoms is what a casualty tells you. So they're telling you that they feel sick. You can't see it, but they're telling you about it. Their arm is hurting. Their head is pounding. They're all things that they're feeling and can tell you and indicate what might be wrong. The other sign you might have seen from what I was doing is while I'm telling you my arm hurts, I'm also clutching it. So watch for people's body position to see what you take away from it. So there are history, our signs and our symptoms. Now as a first aider, when I first started, I always used to think, what have I forgotten to ask? Well, think about sample, signs and symptoms, allergies, medications, past medical history, last meal, and the event. So as we're approaching our casualty, we're picking up on signs, and as we're talking, we're picking up on symptoms. But one of the key questions I always ask first is allergies. Are you allergic to anything? They may tell you, not that I'm aware of, but bear in mind they may not have found out yet because they haven't yet reacted. But they could tell you, I'm allergic to latex. You're not going to go and wear latex gloves when treating that casualty, although these days everything is nitrile. They may tell you they're allergic to plasters, so if they've got a bleed, you're going to stay away from plasters. Or they might tell you I'm allergic to penicillin, and you think, well, that doesn't help me, but it's a key piece of information to tell the ambulance service at your handover because it may affect their future treatment. So key, ask about allergies. Then medication. Again, the medication may help you or it may not. So from a point of view, I'm on Ventolin. That's going to suggest to you, well, I've got asthma. I carry an EpiPen. Oh, well, you may suffer with anaphylaxis. I take Epilin. That person suffers with seizures. So it's information you can take away. But on the other hand, they'll tell you names of drugs and you'll be like, what on earth's that? Don't be frightened to ask, what is that for? Again, it might not help you with your treatment, but again, it's key information to pass on to the ambulance service. Past medical history. Not all of our medical history requires us to be on medication. Maybe we're diabetic that controls it through the meals that we eat, rather than taking medication. So we're asking about past medical history because it might be an indicator. Also, from a point of view of angina, if someone's having chest pains and you say, have you got past medical history, and they say, yes, I've had this before, it might be an indicator it's angina rather than a full-blown heart attack. But always err on the side of caution and go with worst case scenario if you're unsure. So past medical history. Last meal. So when did they last eat and what did they have? Or possibly the meals before that. So if you've got someone throwing up and they're telling you, well, my last meal was breakfast and I had some cereal, probably not going to be the cause. So what did you have last night? Oh, I had that chicken dinner. Yeah, my parents aren't the best of cooks. It was a bit pinky. There's a warning that maybe it's food poisoning. Alternatively, you've got someone who's seeming very confused and faint. When did you last eat? Oh, it's been really busy today. I last had something last night. So you haven't eaten today? No. But it's now the evening? Yeah. So it could be a link to why they're fainting, or it could be a link to the fact that they suffer with diabetes and they aren't eating properly. So again, food and drink is important to help you understand. And finally, event. More detail around what is happening, what's led up to this point. So by using sample, it will help you ask those key questions. Doesn't matter how you phrase them, as long as you get the information. It doesn't matter on the order, although I'd always ask allergies early on after introducing myself as a first aider. But collate that information. So let's see that in practice.
Looking at this individual here who's being ill into the toilet, we can apply sample, and first we would consider signs and symptoms. So we have signs that they are looking generally unwell. There's vomit around the toilet and on their chin. Symptoms, they inform us that they feel generally unwell and they feel like they're going to be sick. Allergies, they say they're not aware that they're allergic to anything. Medication, they're not taking anything. Past meal, they previously had breakfast, and when we inquire further, they previously ate the night before and had a chicken dinner, and the chicken looked a bit pink. The event, they have been feeling unwell all morning and have recently started throwing up. From this basic information, we may start to think that they may have food poisoning and that we just need to keep them topped up with plenty of fluids and monitor them.
So in that example that we looked at with sample, the individual was not in pain. If they are with an injury that's going to cause them pain or a medical condition, we can ask some questions around it to help us better understand how that is changing. So if I've injured my shoulder and I'm moving that shoulder, then that is provoking the pain. If I'm climbing the stairs and I get to the top of the stairs and I get pains in my chest, because I've exerted myself, that is causing my pain. If I've got to the top of the stairs, I sit down and rest and the pain eases, then again that's giving me information and might be making you think that it's angina. If I've got pain in the stomach and I push on it and it eases, but then I let go, again, information of what's going on, and you might start to think of appendicitis. From a point of view, I was saying I pushed in and it eased, and when I let go, it got worse. We all have different levels how we interpret our pain. So it's important to find out what the pain is like for them. So we can give them a score and say, if 0's no pain and 10's the worst pain you've ever had, how would you rate it? Or when I'm holding it in, it's about an 8. But when I let go, it's a 10. Okay, and how long has it been like that? Oh, the last hour? But, you know, for the last day, it's been about a 2. So you've got some history of what's going on and seeing that that pain is getting worse. Also, you've got someone who's injured their arm. And what's the score now? Well, it's a 5. You do some treatment, you put a bandage on, you elevate it. What's the score now? It's a 3. You understand that what you've done has improved things for your casualty. The other thing to think about is where is it and where does it go? So I've got pain in my chest. It's going up the left side of my neck, down the left arm. So we've got radiating pain going through the body. Again, you might be thinking heart attack because of where the pain is pushing on my chest and also travelling through the arm. And in regards to thinking about a heart attack, what's the pain like? Well, it's like a crushing on my chest. It feels like someone's sitting on it, which could be slightly different to someone saying, I've hurt my arm and it's like someone's stabbing me. Or actually, I knocked it and it's just throbbing. So they're all bits of information that can help you understand the length of time that's been going on with the pain that they're in and how it's changed and whether it radiates anywhere or affects anything. So now let's have a look at another scenario and put that into practice.
With this individual sitting in the chair, by applying a sample we can get additional information. The signs, we can see that they're inclined on one arm, they're looking generally unwell, and they're clasping their chest. They inform us from a point of view of symptoms that they have pain in the chest that's going up the neck and down the arm. When we ask about allergies, they inform us they're allergic to bees. And we ask about medication, they mention that they take half an aspirin in the morning and they carry a GTN spray. When we inquire what the GTN is for, they inform us that they have angina. When we ask about the past medical history, we get again the information about angina and that they've been suffering for the last 5 years. When we inquire about the last meal, we find out that they've had lunch, that they had some sandwiches and some crisps. And the last time that they took their aspirin was this morning with breakfast, and they haven't had to use their GTN for a couple of days. When we ask about the event, they mention that they've just climbed the stairs and that the pain started when they reached the top. But normally the pain would ease, but on this occasion it has continued. We can inquire a bit more about the pain, and as we heard from the symptoms, the pain is radiating from the chest, up the neck and down the arm. We picked up that the thing that triggered the pain was climbing the stairs, but on this occasion it is not eased. And we can inquire as to the severity of the pain. Using the scale at 0 is no pain and 10 is the worst pain they've ever had. And they inform us that currently it is an 8. When we ask what the pain would normally be with their angina, they inform us that it is a 5. From this information, we can see that this is not normal for them. We'd err on the side of caution that maybe they're suffering from a heart attack, and we would request the emergency services for them.
So in today's session we've had a look at the secondary assessment that's helped you get a lot more detail and find out what's wrong with your casualty, which can then help you prioritise your treatment. We can think of this as danger response, airway, breathing, circulation, blood, burns, breaks. So we've always got to prioritise that airway. If there's no airway, casualty is going to stop breathing. We need a casualty that's breathing, we need a casualty that has circulation. We then need to be able to control the bleed so they do not bleed out. We then want to be dealing with any burns, and finally with a break. We're not going to go and die from a break, but if the break was causing a bleed, then obviously we deal with that bleed to stop that. So hopefully that's given you a better idea of finding out what's wrong. And remember, sample will help you identify if you asked all the questions. Signs, symptoms, allergies, medication, past medical history, last meal, and event. In the next session we'll be having a look at resuscitation, so I look forward to catching up with you then.